like I said, it becomes important as to what they are going to have to attack. Okay, the virus, bacteria, whatever the case might be. So we're going to definitely come back to that more when we talk about the immune and the lymph system. So in the overall life history of a leukocyte, like I said, those granulocytes, their lifespan is shorter. The A granulocytes, they have a longer one. Just like we saw with the red blood cell production, once again, we're dependent on that one great big huge stem cell. You guys remember that? And how it kind of sits there and gives rise to the colony-forming units, and then they give rise to immature cells, to mature cells. Same principle. For the white blood cells, the difference is they're going to develop in response to need. So when the body needs them, that's when that great big huge stem cell will give rise to those colony forming units that will give rise to the cells. In the white blood cells, a difference that exists, okay? Because remember, red blood cells, we only had to give rise to a red blood cell. But with the white blood cells, I have to be able to give rise to 5 different types. So that means from that big stem cell that formed, now remember, one direction, look back through your notes, you'll see the picture. One showed the colony forming unit for my lymphocytes. So that means those lymphocytes, they needed to be able to develop into what you're going to learn is the T and the B. All right? So that means from that colony forming unit, if it needed to give rise to the B cell, it had to have some receptors for that. So the difference is we're going to have receptors now because it has to determine if I need to give rise to a neutrophil, eosinophil, basophil, lymphocyte, monocyte. Once again, one great big huge stem cell, but now I got to differentiate. So colony forming units will have a receptor for the differentiating factor, meaning it will stimulate one of those 5 white blood cell types. Does that make sense? Kind of seeing some blank stares.
Instead of producing one cell, it produces a blank, and then it's told which version of that cell the white blood cell needs to become.
This. Okay? I have my huge stem cell. And remember, this one simply gives rise to my lymphocytes. This is my colony forming units. See, y'all see the L right there? Okay? For the lymphocytes. But it needs to give rise to 2. So if my body needed the B cells, it needs to have a receptor to give rise to only the B. And that would be the stimulating factor receptor. Down here, giving rise to my monocytes. Don't forget, I can give rise to a red blood cell and a platelet. but I got the rest of my white blood cells to deal with. So it needs to have a way to stimulate it to give rise to a basophil, to give rise to the EO, neutro, or mono. So now I have to deal with those forming units being able to get stimulated to give rise to whatever type of white blood cell is needed. But once again, it just goes all the way back to that one huge stem cell. Is everybody following it? Okay. So once again, the red bone marrow, it'll store my granulocytes. Now look what it's telling me. My red bone marrow will store my granulocytes, neutros, eos, basos. And then and my monocytes. Which one of the 5 is it not storing? Lymphocytes, which are going to become either T or B. All right? So, those lymphocytes, because my stem cell is in the bone marrow, they do get developed there. They do not stay. The B cells, all right, T cells, we're going to move to the blood. In the thymus, whoa, what system was that involved with? My endocrine system. And it's largest at what age group? The children that are growing, babies to roughly puberty. That's when it is largest, because that's when they need to be developing what we term our immune system. So, the T lymphocytes, the reason they're termed T, they migrate to the thymus gland, get exposed to the chemical, the hormone, from the thymus gland, and mature. And they become the T cell. Guess where they go after they mature?
Lymph nodes?
A lymph node. And they simply wait. They wait.
They're waiting for the macrophage?
For my monocyte, which is going to become, or can become, the antigen presenting cell and bring to it a virus or a bacteria. And then guess what the T cell can do?
They identify the bacteria from what's brought back, so they know what to kill.
They will begin to try to make an identification. They will incorporate my B cells to help fight the invasion, because it's going to be B cells that can give rise to an antibody. Is that not cool? That's pretty cool when you think about it. So, becomes the job of them to go into what we call lymph tissues, like lymph nodes and so forth, and help us fight any type of invaders that are coming into us from the outside environment. Well, some of them can come. Anyway, any invaders that are not our self cells. Let's put it that way. So those are our white blood cells, which we'll get more into in the immune chapter. The other formed element that we need to talk about, platelets.
One of the things that the study guy's asking about leukocyte disorders. So is that like
Now,
leukemia?
yeah, just in your textbook, it's going to mention leukocyte disorders. The biggest one, leukemia. All right. So that is the most well-known leukocyte disorder. But your textbook has a good write-up and stuff about that. Platelets. It's the formed element that is not a complete cell, but their function is varied within the bloodstream and the body. And these are the little pieces, all right? And what they're going to play a major role in is something called hemostasis, which is the cessation of bleeding. In other words, and we'll go back to my good old paper cut, okay, the role that they're going to play in stopping that blood flow. And that is termed hemostasis. This does, even though platelets are going to try to help in a situation of hemorrhaging, that is not the bleeding they're going to be the most effective against. Hemorrhaging requires other outside help, like tourniquets, surgery, that sort of thing. Okay? So in the grand scheme of things in the body, when we talk about this process is very dependent on those platelets. It's also dependent on other chemicals in the blood. All right? Have you ever known somebody who might have had a clotting disorder? Ever known someone? A girl I went to school with, first pregnancy was a girl. So she didn't know that she was a carrier for hemophilia. The second pregnancy was a boy, hemophilia. Her third child, a boy, hemophilia. Both of them suffer from hemophilia. So it can be tough. It can be a tough situation to be in. Our platelets become very important in helping stop the flow of blood, and it's not only important when we think of a breach from the body to the outside world, but like I've said before, as we sit here on an everyday basis, vessels throughout the body, they're breaking and reforming, okay? It's just a normal process of the body. Their role, like I said, very important. They have multiple roles as a platelet. They are that small fragment. They come from what is termed a megakaryocyte. Let's take that term apart. What does mega mean? Huge. All right. What does karyo mean? Does anybody remember? Marlisha? It's on. I can see it. It's on the tip of your tongue.
The skin protein or something.
When you're thinking about keratin, okay, a karyo refers to the nucleus. All right. So this is telling me, once again, in my bone marrow, with that big stem cell, I get rise of a megakaryocyte.